everybody! How you doing? My name is Lady Weirdness, and welcome to another surgery game called Hair Transplant Surgery! Paging Dr. Weirdness, paging Dr. Weirdness. What is it? We got a person that needs hair transplant. On it. Let's get into this. Who are we gonna get? Dr. Jeff or Susie today? Bum bum. Bum bum. Susie!
Surgery Squad's virtual hair transplant. I'm Dr. Susie, and I'll be assisting you with this surgery today.
Hello.
A hair transplant is an outpatient procedure that involves transplanting hair follicles from one part of the body, known as the donor site, to the balding part of the body, known as the recipient site. Although hair transplantations are typically used to treat male pattern baldness and restore eyebrows, beard, or chest hair, they can also be used to fill in scars caused by accidents or surgery.
Scars
Today,
are
we'll be
beautiful.
using the strip harvesting method to treat our patient's male pattern baldness. Strip harvesting involves removing a small strip of scalp from the donor site under local anesthesia and transplanting the pieces or grafts of the scalp into the recipient site of the patient's head. Before the surgery, our patient was advised by his doctor to avoid using any medications that may result in a poor take of the grafts. These medications include, but are not limited to, aspirin, ibuprofen, and antacids. Alcohol use and smoking before and after the surgery can also result in poor graft survival. To prepare our patient for the procedure, we'll need to first shampoo his hair with an antibacterial agent to help prevent any infection. I think you can handle that.
I'm gonna shampoo a dude's head. Oh, I can draw with it. Oh, cool. Do I just cover everything? I'm gonna cover everything. Woo! Get it all in there. So much shampoo. Da-da-da-da-da-da. Your head is bubbly. Your head is bubbly. Okay, that's good enough. Oh my gosh, bubbles! Bubble, bubble, bubble head. Bubble head. Cool.
So fresh and clean. Thoroughly rinse
He
the
looks like a
patient's hair,
snowman.
and we're ready to get started.
Boss snowman! Cool. Towel finish.
The next step is to define our patient's target hairline. Go ahead and outline where we want the patient's hairline to be.
I get to doodle on his head? Yeah. And over here. Yeah. Sweet.
That looks good to me.
Yeah.
Let's prepare the donor site. We'll begin by
It
trimming
looks
the
funny
patient's
this
hair in that
way.
area.
His hair looks funny when it's spread like that. That's funny looking. I'm gonna shake your head down, bam. Make you bald in the back of your head. Okay, no more hairs coming up. Okay, cool.
Now that the patient's hair is trimmed down, we'll need to mark the area that we'll be removing.
It does me as a spot. Why does it look like there's a spot right here on my lens? Okay, well, whatever. I get to diddle on your head again. Diddle. I know how to make this work. Big ol' smile on the back of your head. Bam!
Great job! Inject local anesthetic into the marked injection sites to reduce the amount of discomfort our patient may experience.
Oh, no, not needles. I hate needles so much. Oh, I would not want needles to be stuck in the back of my head. That would suck.
Great! He won't feel a thing.
I felt the
Now we'll need
needles,
to
I
remove
bet.
the piece of scalp we outlined from the donor site. Use the scalpel and cut along the line to begin the process.
We get to cut his head? Well, that section of his head won't look too pretty.
Next, we remove the
Big
piece of
bloody
scalp from the
smile.
donor site. Make sure you have a good grip.
Wait, what are we doing? my god! That's disgusting!
Once removed, we'll prepare the piece of scalp for grafting by dissecting the individual follicles. But before we do that, why don't you go ahead and suture the donor site?
You can see his skull! I know his head's gonna look funny because the hair's being pulled up. So the skin is gonna make it. Oh, that sucks. And they gotta stick a band-aid over it, and they gotta let this. Oh. Yeah, this is sounding more and more less fun than anything. Dude, you just had a piece of your head pulled off.
Great, let's get to some dissecting.
Dissecting?
The first thing that we need to do is cut the removed scalp into sections. We'll dissect this one section of skin while our medical assistants take care of the others. Let's remove the individual follicles from the donor material using a pair of tweezers and a sterile razor.
What? Oh, so we're just playing kitchen with pieces of his scalp. Cool. I'm cool with that. Well, the sound is weird.
Nice job. This step
We
is
didn't even
repeated
get to
thousands
finish.
of times to get each follicle prepared. I'll have my assistants finish up. To prepare the recipient site, you'll need to first inject a local anesthetic into the
We
scalp.
gotta peel more
We don't
skin.
want our patient to be uncomfortable.
We gotta peel more skin. We better not.
Now we need to make tiny incisions into the recipient site so that we can place the grafts into the scalp. Use the microblade to make the incisions in the recipient site.
So what, we're just gonna scratch up his face? Oh, I see. We're poking holes in him. Oh, what the hell happened? Dude, look like you got chicken pox in a concentrated area. Or a rash.
Perfect.
That would
With
take
all
a
of the incisions,
while.
It's getting a little messy there. Let's
I
get that
can
cleaned up.
bet you. Duh, you stuck holes in his head.
Much better. Use your tweezers to pick up and insert the hair grafts into the recipient area.
Oh, so we have to Oh, that's a long-ass process. Dude, this would take hours. Oh, holy cow. Did you see that? Looks a little funny. Dude, this seems more or less worth it to get this done. This seems horrible.
You're a natural. Now that you've got the hang of it, we'll repeat these steps for the remainder of the recipient site. After the procedure has been completed, our patient will be prescribed antibiotics to prevent wound or graft infections. For up to a week after the procedure,
It looks
the
like he's got a
area
bruise
may
on
be
his head.
sore, and some numbness may be experienced as well. Our patient can also expect moderate
wear a
swelling
hat.
and redness during this time. Shampooing of the recipient area is typically started 2 days after the surgery. This is important as it prevents scabs from forming. If scabs do form and are left to bond to the hair shaft, the newly transplanted hair follicles may be lost. In about 10 days, our patient will return to have his sutures removed.
Still looks bad.
During the first few days after
Wait,
surgery,
did he have to wear his hair like
almost all of
that?
the transplanted hairs will fall out due to
Oh,
shock loss.
jeez.
Shock loss occurs when the hairs are traumatized by their relocation. Within 2 to 3 months, the patient can expect new hair to begin to grow from the treated area and continue
nice.
to thicken during the following 6 to 9 months. And that's hair transplant surgery. Why not try your surgical skills in another surgery here on SurgerySquad.com?
We're not good. No. Yeah. That was interesting. Doesn't seem all that worth it, but okay. People don't always like to be bald. But seem all that trouble is like you having a piece of your scalp pulled off your head and then stuck in another part of your head. It just seems weird and painful and kind of gross. Just, I don't know. I don't know really anybody that is balding like that. In my family, of course. But it seems like it just doesn't seem all that worth it. Plus all that the time putting the new hairs in all those little teeny tiny holes on your head is like, yeah, I don't know. It just seemed a little weird. But anyway, thank you all so much for watching. If you liked it, hit the like button like a pro, and I will see all you guys in the next video. Bye! Paging Dr. Weirdness, paging Dr. Weirdness.